So today let's look at the process of inflammation. Yeah, just for starters, if you try check for the images that will be projected, you will see that inflammation can occur as a result of various things. So from the image that is at the top left side of the screen, we've a face of a child, and inflammation has occurred as a result of sunburn. So it means it's something that can happen to anyone, but it's always a response mechanism. So throughout our lecture, we'll have a look at it. We'll do a definition. We'll know about the process, the pathophysiology behind it, the signs and symptoms, and how we can manage this condition. So just for an introduction, inflammation, we can define it in various ways. So for today, we'll just do the two definition. The first definition, we can define it as it's a local response of living body tissues to injury due to any agent. Then another definition, we can also say it's always a complex biological response of body tissues to harmful stimuli such as pathogens, damaged cells, or even irritants. So this means that it's always a response. It's how the body is meant to work. So in case of this, it's supposed to give us a response. So that is just an introduction about the aspect of inflammation. So from the three images, it's all about inflammation. If you try check with inflammation there, then we have also inflammation here. So it's in most instances, we ought to confuse it with cellulitis, of which is a lecture that we did last week. So you're supposed to also be able to differentiate between the two. Is it inflammation or is it cellulitis? And remember, for cellulitis, we said it always involves a bacteria has to be involved, and also we are looking at the subcutaneous fat tissue. Or let's just talk about the skin. But for inflammation, we just it's always a local response of living body tissues to injury due to any agent. And for definition two, it's always a complex biological response to body tissues to harmful stimuli such as we can talk of pathogens, damaged cells, or even irritants. That's when inflammation can take place. Then you ought also to differentiate it from the aspect of allergies. Also, allergy is always a response toward, we always talk of allergens or other irritants. So it's something that you need to be key with it. So you need also to know that inflammation is a protective response, and it involves three things. One, we talk of the immune cells. Two, we talk of the blood vessels. Then three, we talk of molecular mediators. So this means that all these three things they have to take place so as for the protective response to take place. Another thing, it's also the body defense reaction to immediate, or we can say it's just the body's defense reaction to eliminate or limit the spread of injurious agent. So ideally, the body tries to maintain the aspect of homeostasis. So what are the possible causes of inflammation? And you can just remember from our second definition where we said it's the complex biological response of body tissues to harmful stimuli such as pathogens, damaged cells, or even irritants. So what are the possible causes, the things that can bring about this inflammation? So for causes, we'll look at it under five things. So the first thing, we look at the infective agents. So for the infective agents, we talk of things like bacteria, viruses, fungi, parasites, and all other toxins that might be associated with this infective agent. So if it's a toxin that is associated with a certain parasite or a certain fungi, it will always cause inflammation. Okay, so that is something about the infective agents. Two, we talk of the immunological agents. So under immunological agents, we focus on cell-mediated and antigen antibody reactions. Then three, you can also talk of physical agents. So we are talking of things like heat, cold, radiation, or mechanical trauma. So for the physical agents, if you try check the images that we projected, the one that is at the far top corner, it's a face of a child. Then if you try check inflammation has already taken place, then we've said that it was as a result of sunburn. So we classify it under the physical agents. Then we are just looking at the heat. So the heat is the one that caused the body to come up with the inflammation. Then the fourth one, we talk of chemical agents. So for chemical agents, we mainly talk for organic or inorganic poisons. Then finally, we talk of inert materials. So for inert materials, we talk of the foreign bodies, and they need to be chemically inactive for them to be classified under inert materials. So those are the 5 causes of inflammation. Then what are the key signs of inflammation? So you ought to know we always have the 4 cardinal signs. This always according to Celsius, Paracelsus. So he came up with the 4 cardinal signs, of which we'll talk of. Let me change my color. Of which we'll talk about the redness, with swelling, with heat, then with pain. Those are the 4 cardinal signs. Then the 5th one is always loss of function, and this is always according to Vicro. So don't forget about that. You might be asked about the cardinal signs according to Celsius. So Celsius, he came up with the four cardinal signs. Then the 5th one, which is loss of function, that's according to Vicro. That's about the signs of inflammation. So ideally there are 5, then we categorize them into 4, then the other one. Yeah. So after looking at the causes, probably we can just look at the types of inflammation. So for types, you ought to know we classify them into 2. We look at acute, then the chronic. And for acute, for anything that we term it as acute, is always it always has a short duration, and it represents the early body reaction, which is always followed by healing. What about chronic? Chronic inflammation, it takes a longer duration. Then we have to know that the causative agent of acute inflammation persists for a long time. So this means that in case we are having acute inflammation, then the inflammation persists for a long period of time with the causative agent. At this point, we'll term it as chronic inflammation. Then someone will be presenting with the 5 cardinal signs that we've looked at. Okay. So after that, let's look at, we can check the inflammatory process or the response, or we can also term it as the process of inflammation. So all this process involves the following events. So we always have the vascular events or vascular response. Then we talk of cellular events or cellular response. So for vascular, we have the hemodynamic changes, of which later we'll look at it in detail. Then we've also altered permeability. What about cellular events? We always have exudation of leukocytes and also phagocytosis. So let's start with vascular events of vascular response, which entails hemodynamic changes and the altered vascular permeability. How does it come about? So for vascular changes, I will start with the hemodynamic changes. So for hemodynamic changes to occur, one, we always have the transient vasoconstriction. So ideally, we're just saying this is always the immediate vascular response. And all this comes so as to achieve hemostasis, irrespective of the type of injury. So it's ideally the response of the body. It tries to achieve hemostasis irrespective of the type of injury. Then after the transient vasoconstriction, we always have persistent progressive vasodilation. So vasoconstriction starts first. So for persistent progressive vasodilation, it involves mainly the arterioles, but to a lesser extent, the capillaries can also be involved. So all this results to an increase in blood volume. You need to note about that in the macrovascular bed of the site of acute inflammation. So we have increased blood volume in the microvascular bed of the site of acute inflammation. Then the third thing, you always have elevated local hydrostatic pressure. So how does the elevated local hydrostatic pressure come about? So it's always caused by the aspect of progressive vasodilation. And all this will always result in transduction of the fluid into the local site. Then once the fluid is around the local sites, and also you need to remember we've talked of the increased blood volume, so we'll be having edema. That's how edema comes about because of the elevated hydrostatic pressure. So throughout the process of inflammation, we ought to have all the signs and symptoms about the four cardinal and the fifth cardinal sign. So for the first part, we've already looked on how the swelling or edema comes about. So let's continue. Then you need to know about slowing or even stasis of the microcirculation follows, causing decreased concentration of RBCs. Thus, we are having raised blood viscosity. So the diagram tries to give us the distinct differences between the two blood vessels. So for the one that is at the far right side, this is a normal vessel. We're having arterial, we're having our capillaries, and these are venule. So if you try check the other side, for the arterial, we are having the vasoconstriction took place. Now we're having vasodilation. And all this will always bring about the extracellular expansion, the way we've just looked at that. So it means the fluid will start leaking, the exudate will start leaking, and as it leaks, so we are having the swelling or the edema. So you can try check. Let me use a different color. So at this point, we'll start having the edema that we are talking about. Next, we'll look at the altered vascular permeability. Now, how does the altered vascular permeability come about? So there are always two mechanisms. One, we talk about the chemical mediators of acute inflammation, which may cause retention of the endothelial cells, leaving intracellular gaps. So at this point, we term it as chemical mediated vascular leakage. Then, toxins and physical agents may cause necrosis of the vascular endothelium, and this leads to abnormal leakage, of which you can term it as injury-induced vascular leakage. So for altered vascular permeability, we have the two things. Let me change my color. Sorry, just a little bit. Let me turn. Okay. So we are having the two things. So we're having the chemical mediated vascular leakage and the injury-induced vascular leakage. And we've explained how the two mechanisms bring about the altered vascular permeability. So up to this point, we've already covered about the vascular response of vascular events. So next we'll look at the cellular events. Now how does it take place? So for cellular events, one, we're having the formation of cellular exudate. So just a question for you, how do white blood cells get out of circulation and into the area where they are needed? So you need to know that the movement of the leukocytes from the vessel lumen in the directional fashion to the site of tissue damage is always called chemotaxis. So chemotaxis helps the leukocytes from the vessel to move into the site of tissue damage. That's about the chemotaxis. So all granulocytes and monocytes respond to chemotactic factors and move along a concentration gradient. So there's always a concentration gradient that is always created. So this means it moves from an area of lesser concentration of the factor to an area of greater concentration of the same factor, of which we're talking about the chemotactic factors. Two, phagocytosis takes place. So phagocytosis, if you ask what is phagocytosis, you ought to know that this is always a process whereby cells ingest solid particles. Then the first steps of phagocytosis is always additions of the particle to be phagocytosed to the cell surface. Okay, so once it has already been ingested, the attached particles by sending no, let me repeat again. with the aspect of phagocytosis, of which we've said is always where the cells ingest solid particles. So once it has already ingested the solid particles, so they always meet and fuse so that the particles lies in the phagocytotic vacuole, or we can also term it as phagosome. For those who have done a bit of not pharmacology, for those who have done a bit of anatomy and physiology, so with the aspect of phagosome at this point, which is always bounded by a cell membrane. Then lysosomes then fuse with the phagosomes to form phagolysosomes. Then it's within this that intracellular killing of the microorganisms occurs. So that's all about phagocytosis. Just to make it more simple, you said it's always a process where cells ingest solid particles. So for instance, if this is my solid particle, then let me just draw. Then the solid particles is always ingested. So the solid particle is always ingested. So at this point, we term it as phagosome once it has already been ingested. Okay. Then after that, lysosomes now will come in. Let me draw some lysosomes. So lysosomes will also come in to ingest all this thing. So at this point, we term it as phagolysosomes. Then now we'll be having the killing, which will now take place. Okay. So up to that point, we've done about the vascular events or vascular response plus the cellular events or cellular response. So at this point, phagocytosis are already taken place. So the diagram tries to show how inflammation takes place, and is just a representation of what we've just looked at. So what are the factors that might influence chronic inflammation? So there are various factors that might influence chronic inflammation. So this means that the inflammation has taken a longer period of time. So we have the diet, we check out the diet, the physical activity, where we tell people to avoid sedentary lifestyle. Then we have the aspect of smoking, with the aspect of obesity, where we check the BMI. Don't forget about that, body mass index. Then you have to know how we calculate. Then also alcohol consumption takes a place in the factors that influence chronic inflammation. Then you ought to know even stress can affect inflammation. So if you ask about the factors, those are the factors. Okay, so we've looked at inflammation, then we've said it's always just a response, but also this response can bring about disorders, of which let's look at the disorders of inflammation. As we try look at it, it doesn't mean that it's a bad thing, but if to some point it can come up with some disorders, of which let's look at it. So you ought to know that for inflammatory abnormalities, these are a large group of disorders that underlie a vast variety of human diseases. So there are diseases that are always as a result of this inflammation. So examples of these disorders that are always associated with inflammation, we talk of like acne, we talk of asthma, we talk of autoimmune diseases, of which we can look, there are many, multiple sclerosis, with systemic lupus erythematosus, among other diseases. Then we also have chronic prostatitis, which mainly affects men. Then we have diverticulitis with glomerulonephritis, among other diseases. Okay, so once we've known about the disorders, then it's prudent for us to know how can we come up with proper management of patients with inflammation. So you have to know we also do depending with how the patient presents. So in case if you're having pyrexia or fever, so it always occurs due to bacteremia. So it means we're having a bacterial infection. So we had to administer the prescribed antipyretics A good example is always paracetamol. So during your free time, you can go check what is the mode of action. How does paracetamol help in reducing the fever? Okay, then we're supposed to give high caloric diet in form of carbohydrates. Why should we do this? Because we are trying to meet the increased metabolic demand in patients with fever. So when the fever is high, it also means the metabolic rate is always high. So we ought to give them high caloric diet in form of carbohydrates. That's why we give it. What about leukocytosis? So it's usually in bacterial infections. So we ought to have neutropenia. And for viral infections, they always call lymphocytosis. Then parasitic infections, we mainly focus on the eosinophils, of which we term it as eosinophilia. So we have to administer antibacterial agents as prescribed. What about diet? We need to provide easily digestible diet. So we talk of light diet. Then keep fluid balance and give high protein diet for the formation of new tissues. Don't forget about that. We give high protein diet for the formation of new tissues to build up the destroyed tissues. Then we can also do sedation because inflammation will always produce pain. So we can give the sedative drugs so as to induce sleep. Then in case of shock, we talk of systemic activation of coagulation pathway may occur leading to microthrombi throughout the body, and this will always result to DIC, disseminated intravascular coagulopathy. Even bleeding and death can be there. So we can also have severe tissue injuries which results in profuse systemic vasodilation and decreased vascular permeability and intravascular blood loss causing hypotension and shock. So for shock, we mainly give plenty of IV fluids to prevent all this. Then we always even have pain. So we ought to immobilize the affected limb, then administer prescribed analgesics, give anti-inflammatory agents. We talk of issues like indomethacin. I can give the brufen, then also steroids, which includes prednisolone and dexamethasone, so as to reduce the inflammation. Then we can also encourage them to have rest. For the affected limb, we elevate. Okay. And then we can also do local treatment if inflammation is broken and septic. So we use antiseptic to kill the pathogen around the wound, so where we can do Hb10 or even hydrogen peroxide. What are the systemic effects of inflammation? For systemic effects of inflammation, we check for fever, which is always infectious form of inflammation. Then we also have anemia, leukocytosis, and septic shock. Systemic effects of inflammation. Don't forget about that. Systemic. So we talk of fever, anemia, leukocytosis, and septic shock. Okay. So up to that point, we've covered inflammation in detail, where we've looked at the two definitions, the sign, the causes, and how we manage. So if there's any other question, you can just post it down the chat box, then we'll try and answer you. Thank you.